Okay, let's move on. And Dr. Cole, next question. What have you seen in providing the needed and necessary care with what you are doing at Midwest Orthopedics at Rush and with your partners?
Steve, a lot of our responses to this has been driven first by what the federal mandates were and now what's happening locally. And as you know, we've limited services largely in an effort to prevent overwhelming the hospital system and indirectly with social distancing. So we are seeing patients, but mostly we're on a telemedicine first initiative, and we're open for business fully in that regard. And then when patients need to be seen, we take proper precautions, do our physical exams, and then if I need x-rays or MRI, we can get that as well. So it's probably in the office, 15, 20% of what we normally do. I also think that once the elective ban, if you will, or the expansion of essential services happens in Illinois, I don't think it's going to be like the floodgates are opening, quite frankly. I think because of the demand for social distancing and so forth, that people's initial willingness and desire to get out of the house is probably going to be a slow go. And frankly, I think that's probably the right answer, because we're going to be practicing medicine in a way that we're kind of living with COVID rather than saying like after COVID. So I've spent a lot of time thinking about this, but that's kind of where we are today. It has had a dramatic impact, but certainly if people need care, we're there to provide it.
Well, Dr. Cole, I want to now address the physical therapy places out there. And one of the fastest growing physical therapy companies is Ivy Rehab. They have grown now across 11 states. And let's bring on the Chief Development Officer for Ivy Rehab Physical Therapy, Jeremy Vandevender. And Jeremy, thanks so much for being with us here. We want to find out how Ivy Rehab is handling the COVID-19 crisis and what physical therapy places are doing. So tell us how you have shifted from high growth mode prior to the crisis to the current state of operations and your focus.
Thank you. It has been a extreme shock from where we were not 6-7 weeks ago, where we were seeing peak volume in our facilities, and we're on a really strong growth ramp that you mentioned, to going into a place where pretty consistently we've seen drops of more than 50% of our patient volume from the pre-COVID standpoint. With respect to Ivy, as you mentioned, we're in 11 states. We have a significant amount of our operations are on the East Coast and in the Northeast part of the United States, where we've had a earlier and very aggressive impact of COVID. Our headquarters are in the New York metro area, and we've got a lot of offices between New York, New Jersey, Connecticut, as well as our presence in the Midwest. So we've been able to see this impact roll through our facilities much earlier than many other providers may have seen, given that exposure on the East Coast. And what we saw right out the gate is consistent with what we've heard from other industry providers around the drop, particularly in new patients, but also the fear of patients who were previously consistently coming into the clinics, having that a much lower willingness to do that. One thing to point out is across all of our states of operations, and also from the Department of Homeland Security, we have physical therapy as an industry has been stated as being an essential industry in all of the areas that we operate in. So we have embraced that significantly. Obviously, it was a really nice thing to be designated as this. We do feel that the service we provide for our patients is essential. We're addressing their pain and their mobility and their dysfunction during a really critical time. But with that drop in patient volume, as you can imagine, we've had to recourse and find ourselves in areas that we previously weren't, particularly in telehealth. We were able to and have been able to ramp up a national telehealth platform very quickly, to a point where a month ago we had never provided a telehealth visit, and at this point we're doing over 1,000 telehealth visits per day. So it's been a really exciting evolution in the way that we practice and the ability to engage our patients. That being said, we have remained open in nearly all of our facilities across the country. We've practiced very rigid social distancing, cleaning, having personal protective equipment on our therapists, and ensuring that our patients are safe and healthy through the course of this.
Yeah, we're visiting with Jeremy Vandevender. He's with Ivy Rehab Physical Therapy. Jeremy is a physical therapist by background with 21 years of experience in orthopedic and sports medicine as a clinician, educator, operations executive. So it's great to have you on, Jeremy. And Dr. Cole, I'll turn it over to you for the next question.
Jeremy, I'm interested to know, when stay-at-home orders begin to be lifted as they already are in various states, that's not synonymous with normal. And how all of the steps that you just defined, I'm curious, what's your vision of the way your business will look in the next, say, 60 days to 90 days? And I'm curious what you guys are talking about internally, what things have to happen to allow you the runway to actually change and go back in some format to the way things were pre-COVID.
Yes, thank you. One thing that is the most obvious impact to a business, what we're cautiously optimistic and looking towards what's really going to define the story of our next 60 days is how the orthopedic providers, their practices, we've seen really the cessation of anything orthopedic, any surgeries, and even more so the in-clinic visits that are non-surgical, that are often physical therapy cases, really cease to exist over the last 6-7 weeks. So the fundamental thing will be, how does the public, the patient base, react to having some of these restrictions lifted and being able to return to an access to care with surgeons like yourself? That'll be a real driver. One of the things that we've seen and we expect to be a different landscape within the physical therapy world coming out of this stage we're in right now and into the next phase of how we operate across the country is telehealth. As I mentioned before, we rolled out our telehealth program very quickly across an entire platform, something we're really proud of. But when you do that, it's a critical piece for us, the leadership at Ivy, to note that we don't see this being a flash in the pan with telehealth. We see telehealth being a central part of the way that care in the physical therapy world is provided long term. So with that being the case, we're very focused as a leadership team in making the right investments in and developing a fully integrated industry-leading platform that allows patients to access care through telehealth at the highest level they could ever expect, along with in-clinic visits. So I think the future of physical therapy and having telehealth be a part of that is something that is going to be adopted much more quickly than we would have expected without the COVID crisis. That's
it's interesting because our conversations, our narrative is mirroring your narrative, and it's fascinating how we have this layered, or it's sort of an onion. It starts with the interdependence that we have on you providing quality care for our patients. And when we can't see people, then the obvious happens where there's people that are just not getting into your clinics. Can you give me a snapshot of how you think once we get up and running, when I get up and running, which is, every week is a bit more, but I know our throughput, because we will be doing temperature checks, we will be doing history checks. Patients are going to be asked to come in with masks. All of our staff will be wearing masks. I will be wearing a mask. Hygiene takes longer. Wiping down the surfaces, cleaning between rooms, all of that has a burden, and it's the proper burden to protect one another, our staff and our patients. What are you going to do in a physical therapy clinic in the next 60 days? What's it going to look like, physically, if I'm a patient coming in and getting treated hands-on, because I need your hands-on, I need your expertise. Can't get it in a telemedicine visit. What do you think it's going to look like?
Yeah, great question. Those are all things that we have been doing during the course of time where we've remained open. As I mentioned before, our operations are open in 95% of cases across the country within our facilities, where patients do continue to come in for visits. The volume's obviously down based upon some patient concerns, particularly in the Northeast. But so we have been creating an environment similar to what you just described for the last month and a half, where our therapists are wearing masks currently. Our therapists are wearing gloves. Our therapists are practicing social distancing consistently across all of our facilities. We're ensuring that, and we always do this under normal course of time, that cleaning every table, every piece of equipment in between use, but elevating that to a much higher level. We have thermometers in all of our clinics where we're making sure that the patients who do come in, beyond being just screened from a exposure standpoint and understanding where they've been and what might have created a scenario by which they're higher risk, but also doing the temperature checks and making sure that in each event, both our staff and our patients are adequately screened. We're doing that. We're going to continue to do that in perpetuity until we have some guidance that that's not necessary. I would expect that to be for quite a long period of time. So we're in a position now where we've been hyper vigilant around safety and around patient concerns. So I see that continuing, and we're in good practice at this point. What I would expect is that there will be a significant increase in the patients who are looking to go to physical therapy. I think when we look at the volume that will be returning to orthopedic surgery practices and the delays that you as surgeons will have in getting cases in, I think it's a really great opportunity for us to have the chance to work with patients on a preoperative basis to make sure that they're able to overcome any of the deficits that might have been further impacted by the delays that we've experienced. So we're excited for that. And to put our hands on patients, as you mentioned, is the number one thing we do as clinicians. And that's the impact we provide. So making sure we can get those patients into the clinic is critical. I think we're doing everything we could ever be asked to do and more to ensure the safety and health of our patients and our staff.
Their website is rehab.com. And many thanks to Jeremy Vandevender, the Chief Development Officer for Ivy Rehab Physical Therapy, for being our guest here on Sports Medicine Weekly. Thanks, Jeremy. Great stuff. We appreciate continued success for Ivy Rehab.
Thank you very much. Appreciate the time. Stay safe and healthy, and take care.
You as well. We need to take a break here on Sports Medicine Weekly. When we return, Dr. Cole and I will be back with our staple of the show. It's our Ask the Doctor segment. You're listening to Sports Medicine Weekly, only on
670.